Getting your flu vaccination is the most effective way to prevent getting the flu this upcoming season. Peak flu season is February and March, so to ensure prevention, getting your vaccination shot in November is ideal for immunity. Everyone from the ages 6 months and older should be receiving the flu vaccination each year.
Hand washing with soap and water is an effective way to prevent the spread of germs, not only in the healthcare setting, but in your everyday life. Hand washing should be performed anytime your hands are visibly dirty, prior to meals, after bathroom use, and whenever you feel you have come into contact with germs. This is especially important during the flu season. When washing your hands, try to follow these simple steps. Remove your watch and jewelry. Use a warm water and a liquid soap. Vigorously rub your hands together for 15 seconds, making sure that you get the front, the back, down each finger, and interlacing the fingers. Clean under the nails with a nail cleaner if necessary. Rinse with a warm water. Use a paper towel to dry your hands thoroughly, and shut the water off with the paper towel.
Using an alcohol-based hand sanitizer is also an effective way to kill germs and prevent acquiring the flu. You can use sanitizer as an alternative to hand washing whenever soap and water isn't available. Sanitize your hands whenever you come into contact with germs or periodically throughout the day. You can even keep a small bottle in your purse or pocket for easy convenience. Use 2 pumps or squirts and rub your hands vigorously. Be sure to get your wrists and nail beds. Continue rubbing your hands until they are completely dry.
According to the CDC, people with the flu may experience fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. For treatment, the use of antivirals early in the course of the illness can reduce the duration of symptoms. Over-the-counter medications may be helpful in the treating symptoms of the flu. Be sure to get lots of rest and to drink plenty of fluids. If your symptoms worsen or you have a very high fever, contact your healthcare provider. You should also seek help if you have difficulty breathing, bluish skin color, or fever with a rash.